Hi, welcome to our presentation. Today we're going to be discussing the role of an Alameda County Community College Mental Health Navigator. We're going to share information about what the program entails and how you can qualify.
Who are we? Mental health programs in California community colleges currently provide short-term therapy. Ohlone College is leading a program for its fifth year funded by Alameda County Behavioral Health Workforce Development, Education and Training Division to train students on navigating community-based mental health care services. The program aims to improve the referral process for students who need ongoing care. Students from 4 campuses undergo training program on mental health issues and are introduced to mental health agencies in Alameda County. What we do, we ensure that students get support transitioning from campus-based services to community-based services from mental health, housing, food or CalFresh services, medical. This is achieved through a referral process from our campus mental health or basic needs team.
What does a referral look like? So step one, a client is referred to a navigator. Step two, the navigator meets with the client to determine their needs. And step three, the navigator researches community-based services to fit the client's needs. And what our program offers, we offer trainings to learn more in-depth topics like healthcare insurance and the health system in Alameda County and surrounding cities, community engagement in the form of visiting community-based organizations, and outreach and showcases to learn and build rapport with community agencies. We also host social events to promote social connectedness within our cohort.
What types of candidates are we looking for? People who have an ability to work with a diverse group of people, strong communication and listening skills, good interpersonal skills, willingness to serve students, practice self-care and maintain mental health, and experience with mental health care services or advocacy. What will next year look like? Next year, we will have a mandatory summer academy, a mandatory winter academy. We will collaborate with basic needs on our campus. We will have a mental health journal club, a mental health conference, which date is to be determined, and additional trainings such as public health, stress management, suicide prevention, mental health first aid, etc.
The application criteria for our program. Ohlone students have to have at least a 2.75 GPA with full-time enrollment, with other participating campuses having no GPA requirement with a 0.5 or over unit over enrollment, and a vaccination verification required. The job title is included as a student mental health navigator in the Department of the Student Health Center with a time period from August 1st, 2024 to May 31st, 2025, which is over 10 months. Hourly wage is $17.30 per hour, the FTE being approximately 25 to 30 hours per month. The application process. The application portal is open until April 19th, 2024. The virtual interview dates are from May 1st, 2023 to May 8th, 2024, and the final decision announcements will be on Friday, May 17th, 2024.
Now, to hear a little bit about what the program is and how it works for navigators, I'll be asking our navigators a couple of questions just to hear from them in their experience. So, Lacey, how different will the program be next year?
For me personally, next year will be different as I am taking on a role as a senior navigator, and I am excited to see what the new cohort brings as we introduce new organizations and new trainings, which will help better the students that we serve and also ourselves.
Thank you, Lacey. Now, Div, what does a regular navigator working day look like for you?
A typical day for me as a navigator at Las Positas College is arriving at the LPC Health Center and greeting my team which consists of the marriage family therapist and a nurse practitioner. They're on site, by the way. And then I also start my workday by checking on what new cases I have accumulated in my Navigator client case finder. Assisting and providing clients at times may require me to email them, assist them on a phone call, and even meet with them in person.
Thank you, Div. And Heather, what are some key takeaways from this program?
I think some of the biggest takeaways are the relationship building we've done as a cohort. We mentioned that we do socials, and that I think is something in this line of work, in mental health adjacent fields, that we need to be able to rely on our coworkers and colleagues. And I think also the amount of trainings that we've done, just the sheer amount of knowledge that we've received has just been like fantastic. I've learned so much this year and grown so much over the year too. And I think the Navigator cohort encourages us to do inner work during this time too. And so I think I've grown both professionally and personally.
Thank you, Heather. And lastly, we thank you for your interest in the program. If you have any disability and are in need of special services, equipment, or facilities in order to apply or interview for this opening, please contact the Ohlone Student Health Center at 510-659-6258, or you can email the Student Health Center at ohlone.edu. You may also contact Ohlone Human Resources at 510-659-6088. Thank you and good luck.